Very early in life, I knew my purpose was to serve others for the common good. However, I was unsure of exactly how or in which capacity to direct this desire. I've always had a deep interest in healthcare and landed my first job in a hospital setting while finishing my undergraduate work. I truly enjoyed working in the field and interacting with patients. The quest to discover which field in healthcare was most suitable for me continued throughout my degree program and career in healthcare. I was torn between business administration and community health, so I decided to pursue both degree programs. After graduating, I began to take on various roles within the healthcare field, which led me to nonprofit leadership roles and then the Cleveland Clinic. Where I really found my true passion for teaching was in my role as a community health educator. I'll never forget these moments. My love for helping and inspiring others to bring out their higher self was found in the classroom, where I had the chance to actively teach patients and community members about my favorite subject, health and wellness. I loved teaching, the anticipation and excitement of teaching about my greatest passion. I found great joy in making positive contributions to another's life, and I lived for this feeling. It fueled me with passion that I never knew I had. The best part were all the cards, the hugs, and the thank yous from patients who had told me I had changed their life. With that being said, I decided to follow my heart and continue working on teaching. In order to add more tools to my toolbox, I advanced my skills and further grow in this field. I knew at some point I'd need to further my education. I was not looking to education degrees as I could never see myself teaching at a school, but then I heard about the MEPI program. It was just what I was looking for, a perfect fit for my love for teaching and my career in healthcare. It just so happened that my boss passed along some information that came from the channels above about the MEPI program. This program I was really excited about as my passion for education was burning in my new role in the education department, but my experience in educating healthcare professionals was limited. So I enrolled in the program, but shortly after enrolling, I found out that the program wouldn't honor the out of state tuition fees. Needless to say, after much discourse, I wasn't successful in finding the right contact at the clinic who could help solve this tuition situation, and I enrolled into a healthcare delivery process improvement program at ASU. Shortly before the ASU program was going to begin, life took a turn and my mom suffered a stroke that affected the area in her brain associated with memory and speech. After discharging her from the hospital, I took the full responsibility of her full-time care and planned to postpone my enrollment date with ASU. Luckily, I received an email that the out-of-state tuition concern had been worked out due to the efforts of a cohort in Florida. Although I began the MEPI journey 2 weeks late, I knew I made the right choice to follow my heart and go for what the universe had set before me. I couldn't have been happier. This program shifted my level of experience in teaching to not just patients, but healthcare professionals of all types. This was a perfect fit for my growth and my new role at the Cleveland Clinic. I continued to take full-time care of my mom. It all turns out that the skills I learned for caring for patients with dementia at the Cleveland Clinic Brain Health Center paid off tremendously. I was able to rehabilitate my mom with these skills. After a month of caring for my mom and many prayers, my mom was now back to living independently in her own home and has fully recovered from her stroke. Now, back to where I left off with my passion for teaching. Although my teaching philosophy was already influenced by my prior practice and my role as a health educator, it was reinforced even more so when I took the plunge into our first adult learning theory class in the MEPI program. This course opened up my eyes to new perspectives, and I found myself soaking the material deep into my soul. For the past year of this program, I've adopted a formal teaching philosophy based on the social constructivist learning theory and the combined ideas of Malcolm Knowles, David Kolb, Paulo Fiore, Jane Vella, and Lev Vygotsky, who have had a huge impact on my perspectives and the development of my formal teaching philosophy. Developing learning objectives, course curriculum, and teaching methods has been strengthened due to my MEPI coursework, and I'm able to directly apply this knowledge to my work as an education program manager. Good thing, because this is an essential part of my job duties, developing and managing physician and student education programs at the Cleveland Clinic. Also within my role, it became a necessity to become more familiar with online learning environment, especially after the COVID-19 pandemic when all of our education programs shifted to a virtual environment. Thankfully, our multimedia course taught us the functions of a learning management system, as well as the profound impact multimedia principles have on the learning experience. It takes a lot of creativity to develop virtual programs that also meet the needs of social learners. Last semester, we learned various types of teaching methods such as debate, fishbowl, demonstration learning, and gamification, which has broadened my capabilities in my role and enhanced the learning experience that can be applied to both in-person and online courses. Most importantly, my coursework in educational research and our capstone project has paved the way for a future career path in program development, which has been one of my lifelong dreams since I began my work in healthcare. Acquiring the necessary tools to develop research programs has allowed me to showcase my knowledge in research designs and develop projects for federal funding opportunities. Even though this class was my first introduction to research methods, I find it truly fascinating not only to develop research programs for funding, but also to study their effectiveness on targeted populations. Being able to assess and evaluate research papers and receive peer feedback and review has had a significant impact on my growth in this desired area. With that being said, I envision my future geared more toward program development and hope to strengthen my skills in research methods. This will enable me to build stronger cases for grant applications and increase my ability to have a stronger impact on my learners. To do this, I hope to learn more about research methods in the coming year to be successful in building new programs for our community. Another area that I'd like to improve upon is my own feelings of imposter syndrome as a health professions educator. Because I lack clinical background, I feel inferior teaching clinical healthcare professionals. My fellow MEPI program peers have been incredibly kind and generous, which has helped me significantly in gaining confidence. They have had an impact on my life in more ways than I can say with words. I'd also like to stay up to date on medical information which will assist me in my role as an educator. This information presents alternative approaches to learning. These new approaches could lead our center in a new direction away from physician-led didactic lectures to a partnership between physicians and education staff, creating interactive learning activities together.